All right, here we go. This one goes out to families, and I'm actually off work today, but I have this on my mind, and I have to get it out of my head. Spent the day on, I guess it would have been Wednesday afternoon, Tuesday afternoon, whatever day it was. Spent the day with a man who had lost his son to this disease, and he was telling me the story about it. And as we were talking, you know, I really sort of I start to take note of the themes that start to emerge. And then that night, Wednesday night, you know, I was in our coaches meeting, and I realized, you know, there are 3 or 4 moms in there who lost a child to this disease. In all these cases, it's like 30 and under. In all these cases, you know, the kids were, you know, from a family that really trying to do the right thing. Not that it matters. I mean, anybody who loses anybody from this disease, it doesn't matter what the family background was. It's not a good kid versus a bad kid. But my point with this is everyone was trying to do the right thing. And on the surface, it looked like it was the right thing and everything was going okay. But it's interesting when you hear people talk about that, the themes that come up. Number one, inability to access advice or feedback or just support, just information. They all told the same story. Every phone call they made was, you know, was basically this model of how do I get you into my treatment center, or how do I get you into my intensive outpatient program, or how do I get you evaluated? What is your insurance? It was this process that, you know, there really was no just plain advice being given to these families. And I guess that's just the way it is, man. I guess that's just the way it is. This medical model that's set up, that's just how it works. But man, it's disheartening. It was sad. It was very, very sad to hear these people talk about it. And the second thing, and this is even more tragic, they were told over and over again by professionals, quote unquote professionals, ranging from medical doctors to addiction treatment professionals to psychiatrists. They were told over and over again, you know, step off, don't do anything for your kid, allow them to hit bottom, and when they want it, then help them get into treatment. You can't do anything, ma'am. You can't do anything, Dad. That kind of thing. It's astounding to me that in today's day and age of heroin overdoses, of fentanyl and carfentanil, that professionals are out there still talking like that. And I'm not talking about self-help groups. I'm not talking about somebody's sponsor. I don't really think anyone should be saying it, but those folks don't have any ethical obligation. But are we really that misinformed? If you're out there and you're a treatment professional, do you really think that a person has to, quote unquote, hit bottom, even though there's no evidence that ever worked for anybody anywhere, even though there are methods like the ARISE intervention model that we use at Favor, like CRAFT, like motivational interviewing, harm reduction techniques. There are all this research-based evidence that suggests that there are other ways to go about it. But you're holding dear to this you got to hit bottom model. And here's the thing. It would be one thing if I heard one family said that. I'd be like, well, that's a one-off. They ran into the wrong person. 2 families, 15, 20, 30 families. Over the past 4 years, I bet you I've talked to 40-plus families that have lost somebody. And the story is eerily similar. You know what? It was one thing when my wife had to figure out what to do with me. I get it. She had to do the tough love thing. She had to do the step-off thing. And she was able to do it. I don't even think it's the best approach in those situations, but at least that makes sense. But when it's like a mom to a child, or even a dad to a child, but especially mom to a child, and we start labeling them an enabler and giving them speeches about tough love, come on, man. If you're out there doing that and you're working in this field and you're talking like that, shake your head. And this is for parents. Understand, you want to set boundaries, but you don't have to cut the person off. If you make a decision to cut the person off, I respect that, and we will support you through that. But don't let other people tell you that you have to do that. If you do that, it'll usually come at the end of a series of events. And basically, you'll be so worn out where you have to do it to protect yourself. And I respect that. You got to set boundaries to protect you. But the idea of cut somebody off. I actually heard a professional person, at least he described himself as a professional person. I think he was on Facebook or something. So he really probably wasn't a professional, but he was saying he worked in the treatment industry. I heard him say, don't even give him a bologna sandwich. First of all, who the hell wants a bologna sandwich? And really? Well, I'm here to tell you, meet them for lunch. Meet them for a cup of coffee. Talk to them about the weather. Talk to them about a football game. Don't pay their rent. Don't pay their cell phone. Don't pay, their car payment when they're in the middle of an active addiction. But give them a bologna sandwich. All right. So pass this on. If you're a parent, share this with other parents. You don't have to cut them off completely. If professionals are telling you that, it's not based on any kind of research. It's literally based on a cliche. Understand that if healthcare professionals are telling you that, treatment professionals, they're giving you guidance based on a cliche. All right, stay tuned here. Keep checking us out here. Check out my blog at recoverycartel.com. Let's get some alternative messaging and some alternative information out there. Have a great weekend, y'all. I just said y'all.